Did you know that cardiovascular disease is the leading cause of death in Canada and the US? The shocking part is that most people don't know they have it until it's too late. So I remember in medical school, I was learning from a pathologist, and he asked us, what is the most common symptom of cardiovascular disease? So we thought, okay, is it chest pain? Nope. Shortness of breath? Nope. He answered that the most common symptom of cardiovascular disease is often death. So it's known as the silent killer. And I've seen many while working in the hospital that present with their first heart attack or stroke after just having a visit with their family doctors a few weeks or months prior and having been given a clean bill of health saying all your labs are normal, and they were just shocked that this had even happened to them. But we must remember that there are limitations to a lot of these blood tests, and they're not optimal ranges. In fact, that normal range is based on our population. And unfortunately, the regular population is not always the ideal picture of health. And when I was practicing as a family doctor in offices, oftentimes I would see patients with borderline cholesterol or borderline blood sugars, and there really wasn't much offered until we had to prescribe statins or medications to help with blood sugar regulation. Until I discovered functional medicine. And now as an integrative health practitioner, I know there are so many things you can do to improve your cardiovascular health and reduce the risk of developing disease and symptoms way before your labs are abnormal or before you need medication. I've also become aware of key labs and screening tests to really know where you stand and what you need to do on a personal level to take action and reduce your risk. That's why I'm excited to invite you to a 6-week Resilient Heart virtual boot camp. It's specifically designed for women who want to take control of their cardiovascular health now before it's too late. We'll teach you simple and powerful steps that you can start taking immediately to protect and empower your heart. Cardiovascular disease does not discriminate. It can impact all ages, all shapes, all sizes. I want to share with you things that, as a GP, I wish I knew 10 years ago. Let's start taking action now before your labs become abnormal. There's so much we can do before you start showing signs of disease. Now, as an integrative health practitioner, I want to share key steps and things you need to know. The key is lifestyle changes. And a lot of the times you'll hear that from your family doctor. You need to work on your lifestyle changes. Well, what exactly does that mean? Well, that's where we're going to dive deeper into what that means. And I will provide clarity on exactly what that means. And also providing more personalized care. The Resilient Heart is your chance to take the reins and optimize your cardiovascular health before you even need to see a cardiologist. Click here to join and start your journey towards optimal health. Let's make cardiovascular disease a thing of the past.